Thank you.
There we are. All right, it's nice to see everyone today. It's great to start having more meetings in person again. And Chair Outman, I thank you very much for the invitation, and members of the Senate Appropriations Subcommittee on Community Health and Human Services. We are very appreciative for the chance to be here today. I'm Janet Reynolds Snyder. I'm Executive Director of the Michigan Federation for Children and Families, the statewide association of 56 member agencies that provide services to children and families throughout all 83 counties in Michigan. All of our members are private, nonprofit, community-based organizations. Dave Gehm, who is with me here today, is President and CEO of one of our member organizations, Wellspring Lutheran Services, and also Dave is also a member of our board of directors. I'm just going to say that I also am really privileged to be the past president of the National Organization of State Associations for Children. So this gives me a really unique opportunity to see what other states are doing in child welfare and behavioral health services, and how they're supporting families in their states, as well as how we are supporting children and families here in Michigan. One of the first things as we begin, we would like to thank you for the recent appropriation of $6.2 million for child caring institutions, or CCIs, or residential treatment agencies. And those funds came from the $1.2 billion healthcare supplemental, and all federal funds going to the CCIs to help combat the impact from the COVID-19 public health emergency. As our residential care providers take care of some of the youth in our state with the highest of needs, our providers are providing exceptional care 24/7. With that, so we thank you for that. We thank you for that. It means a great deal, and it was sorely needed. With that, I'm going to turn some comments over to Dave.
Good afternoon. Thank you. Thank you for the opportunity to be here with you today. As Janet said, I'm Dave Gehm. I'm CEO at Wellspring Lutheran Services. Wellspring's a little unique in the work that we do as a human care and services provider, in that we serve children and families and at-risk seniors across the state of Michigan. And we're in something like 50 to 53 of Michigan's 83 counties. And so we have a pretty unique perspective on human services across the state. And it's a pleasure to be with you today. The conversation around appropriations for child welfare and family services in the state of Michigan is timely for a lot of reasons, not the least of which is our families, our youth in these programs, or needing to be in some of these programs, are stressed, as are the systems that are providing services to them. And I just want to, I've submitted a written testimony for you, so I just want to hit some of those highlights. There are really three sort of trends, if you will, that I wanted to highlight for you that have uniquely impacted the private agencies that do this work across the state. And they're not new to us, but I think have uniquely impacted the work of private agencies. The first has to do with workforce shortages, which again is not new. We're experiencing it all over the state, and we know that restaurateurs and hospitality industry and other service industries have had to adjust menus, adjust hours, cut back on various things in order to accommodate a smaller workforce, and that makes perfect sense. What doesn't work for us is that in that we're providing 24/7 care, and interestingly enough, the crises that happen to our families don't happen 9 to 5 Monday through Friday, and so a smaller workforce just isn't working for us. And I think it goes to the question earlier as well about the foster families and the recruitment and the retention of foster families, because while we're serving with fewer workers, we're seeing families with greater needs in terms of mental health and behavioral health wraparound services that Director Starling mentioned. But it's almost universal now, given the trauma and the stresses of the pandemic, that kids and families in these systems are needing more and more of that. And frankly, I think when we think about recruiting foster families or trying to retain foster families, we need to be able to wrap those services around them so that they can do that work, that they're volunteering, if you will, of becoming foster families is better supported for this sort of new world that we're in terms of the behavioral and mental health needs of kids. And so when we think about part of the workforce challenge for us isn't just the amount of staff, which we need to address, and there's some appropriations and some things we need to do about that, but we're burning good staff out. The longer we can't address it, the longer we can't give them the behavioral and mental health supports to wrap around their clients, we're burning good people out. And it breaks my heart because they've dedicated themselves to this work. So I'm going to move quickly then to wage inflation, which is sort of a subset of inflation in general and how it's affecting these agencies. And the first is obvious. We're now competing with other businesses that we never competed with before for workforce. And so that has put challenge on us. But probably more significantly is the fact that every time we raise wages, we're giving away either very thin margins or in most cases, we're just further deficit spending in the programs that we have, recognizing that much of the work we do, in fact, almost all of it in child welfare, is dependent on appropriations that come from the legislature and are administered through DHHS. And sometimes those contracts are out 3 years. We signed contracts in 2019 not having any idea what the inflationary impact was going to be, let alone the additional resources necessary to get through a pandemic. And so we are literally dependent on you to help us in a more of a rapid cycle deal with the fact that wage inflation is real and it's further eroding our workforce situation. And so we would just sort of have you think about that a little bit differently. And last, just I wanted you to think about the changing nature of the work that we're doing. And it goes back to the issue of behavioral mental health needs of our youth and the families that these youth reside in, whether they're in-home or out-of-home care. We're seeing it across the board. And so I would urge you, as you think about appropriations, to think about expanding programs that we know work. And in the out-of-home care, in the foster care world, I would just highlight treatment foster care and enhanced foster care, which allow us, they're different but similar in that they allow us to bring those behavioral health, mental health, and other services and wrap around that youth in the foster home or in the foster setting. It's efficient and it's effective, and we just need more of it. The other thing I would say is, and I know we're committed to this, but the expansion of family preservation in the state of Michigan, Director Starling again talked about this, we're in lockstep on that. It's a preventative program, it works. Wellspring happens to be the state's largest provider of this service, and we see results. We keep families together and further eliminates or at least reduces further trauma to kids who might otherwise be removed into foster care, and frankly, is a cost-effective way for us to serve families in the state of Michigan. And so that would be really smart for us to find ways to expand that. And finally, the CCIs that we've talked about already. Wellspring does provide that kind of work, and these are the most disadvantaged children in our system. And the needs of these youth are profound. And what we're suffering from there is frankly chronic years of underinvestment in those programs. And so we would really raise that up as saying it's time for us to really invest in this small but really important set of kids who are the most disadvantaged, the most needy, and that need is growing. So I hope, as you think about appropriation, I know it's always like, the short-term pressure of this budget, but this is a good moment for us to sort of look ahead as well and try to take the long view and make the smart investments in programs that are going to help us really serve families as we move what we all hope to be the post-pandemic world here. Those behavioral mental health needs aren't going to change, and so we've got to get really clear about how best to serve them. And so I would certainly turn it back over to Janet to talk about some of the specific budget focus we would have.
Thank you very much, Dave. Yes, along with the printout of my testimony, I also submitted for each of you the Federation's budget priorities for fiscal year 23. Two of those are in support of the governor's executive recommendations along the lines of rate increases for foster and adoptive families and juvenile guardians, and also increasing behavioral health capacity and investing in structural reform. We would encourage support in those areas. As Dave has spoken to the importance of the workforce, that this is another area of budget priority for Federation members, and we are asking for support of an additional $32 million appropriation to fund hero pay for child welfare workers and other related items that would be similar to other investments that have been made for frontline workers in healthcare, behavioral health, nursing home, teacher retention, and others, but have left the child welfare professionals out of this mix. So especially for the reasons Dave mentioned and the COVID-19 impact, we would ask that investment. Also, to encourage increasing our family preservation programming. Rates have not been adjusted for family preservation providers since 2009. And we're looking more and more at how we keep families together. We're looking at generational approaches, a 2-gen approach, a whole family approach to family preservation and child welfare services. And we're asking for an investment of 15% or $8.55 million that would simply reflect increased costs since 2009. Urgently, I am asking you to consider changes for rates for Qrtps or residential treatment providers, or otherwise known as the CCIs, the CCIs. The governor's executive budget recommendations includes a one-time appropriation of $15 million. So clearly that, if it were to pass, that would take effect as of October 1st. The intention for that $15 million is for COVID-19 impact relief, and it is through the use of federal dollars. We would ask you to consider funding that $15 million now through supplemental that would help residential providers with recovery from COVID impact, similar as you did with the 6.2 that was passed recently in the healthcare supplemental. That is of urgent need. We are also the governor's budget recommendation also includes a 5% increase for residential providers, or Qrtps. This 5% reflects an actuarial study that was done through a state contracted entity public consulting group, or PCG, and recommendations that came from PCG for a 5% increase for Qrtp providers. The flaw here is that the data that was used to determine this rate was based on was from 2019 and does not reflect any of the issues that we've talked about here today, the public health emergency, the impact from that, the workforce shortages, the increased acuity and needs of children in our care. So for that reason, we are requesting that you would increase that rate adjustment to 20%, which would be a $42 million appropriation. So with that, I'll stop. And thank you very, very much for your time and your attention. And Dave and I certainly are happy to answer any questions you may have.
All right, thank you. Members, any questions? We do have a few, it's a hard stop at 1:30, so. You have a question, Doc? I do. Okay.
Thank you very much for being here, and you do some very important work that we are all very appreciative of.
Thank you.
In the past couple of years, we had the Family First federal dollars that have been flowing through, and I was going to ask, have you accessed these dollars? How many dollars have you accessed, and what did it go to?
Yes, so thank you, Senator Bison. You know, so the Family First dollars flow through Michigan Department of Health and Human Services and are tied directly, you know, the drawdown of those funds are tied directly to our use of Qrtps, or actually the operationalizing of Qrtps. So Qrtps having to meet specific criteria and standards, which all Federation members have met 2 years ago. It also is dependent on the, well, the Family First funds also, when we bring on the Qrtps, which we have, also allow us to use those funds, yes, for family preservation services. Our state's prevention plan has been submitted to the federal government, and I think has gone back and forth several times for approval. I don't believe, and this is probably a question better for Director Starling and his staff, I don't believe that our prevention plan has yet been formally approved. So I don't believe that we're eligible to start drawing down funds in a different way or at a different level. It's my understanding, though, when that final approval happens, which I think is going to be fairly soon, but I'm not part of those conversations, nor are our members. My understanding would be, though, that those funds could be drawn retroactively to October 1st of '21.
I have to express my disappointment that we haven't accessed all the dollars that we had available, and perhaps Director Hertel could eventually inform us of what's going on. That, you know, it's now been a fair amount of time, and we'll look forward to finding out what's going on. Thank you very much. I appreciate your insights.
Thanks, Doc. And because we're pressed for time, we better end this. If there's any other questions members have, we don't have time. We got a hard stop at 1:30. So if you got questions, you can ask them afterwards. We need a motion to excuse absent members. Senator Lasada. And seeing no objections, we're going to adjourn the meeting.